So our next topic is lung cancer. Remember that smoking and asbestosis are two important risk factors for lung cancer. Other than that, arsenic, radon, nickel chromate, chromatic hydrocarbon, and cryptogenic fibrosing alveolatus, they can also cause lung cancer. Coal dust can also cause lung cancer. Smoking and asbestosis, they are synergistic. If someone who is a smoker and also there's asbestos exposure, then his risk of getting lung cancer is increased synergistically. Smoking increases the risk of lung cancer by a factor of 10, and asbestosis increases the risk of lung cancer by a factor of 5. So if someone is exposed to both of them, then his the chances of his getting lung cancer is 50 times increased. What are the signs and symptoms of lung cancer? Someone who is old or above 40 years of age and has a history of smoking and who present to you with chest pain, weight loss, appetite loss, cough, fatigue, and shortness of breath, or hemoptysis, then you will suspect lung cancer. So history of smoking in elderly who present to us with chronic cough and weight loss and hemoptysis, you will suspect lung cancer. Initial investigation in case of lung cancer will be X-ray. This is the first investigation that is done in patient with suspected lung cancer. In around 10% of the patient with lung cancer, chest X-ray is usually normal. CT scan is the investigation of choice, and bronchoscopy is done to take a biopsy and to determine the histologic type of the lung cancer. PET scanning, when PET scanning is done in non-small cell lung cancer to find the curative treatment. In this procedure, a radioactive material, 18-fluorodeoxygenase is used that is preferentially taken up by the neoplastic tissues. So PET scanning can be used if there is metastasis or there's a suspicion of non-small lung cancer. So initial investigation is X-ray. In case of suspected lung cancer, investigation of choice is CT scan to determine the histological diagnosis, histologic type, either small cell or non-small cell, or which type of non-small cell cancer. For that, we need to do bronchoscopy, and PET scanning is done for a local as well as a distant metastasis in case of non-small lung cancer. There are two types of lung cancer. One is small cell lung cancer and one is non-small cell lung cancer. Non-small cell lung cancer has further subtypes. That is, non-small lung cancer can be squamous cell carcinoma, it can be adenocarcinoma, it can be large cell carcinoma, it can be alveolar cell carcinoma as well. So basically, there are two types of lung cancer: small cell lung cancer and non-small cell lung cancer. And non-small cell lung cancer is further divided into other types, that is squamous cell adenocarcinoma and large cell carcinoma and alveolar cell carcinoma. Lung cancers are usually associated with paraneoplastic syndrome. So now some hints towards the diagnosis of small cell lung cancer and non-small cell lung cancer, such as squamous carcinoma. Remember that small cell lung cancer and squamous cell carcinoma, both of them are related with paraneoplastic syndrome. They can secrete endocrine hormones such as small cell lung cancer is associated with the release of ADH and ACTH. What will happen if small cell cancer of the lung is secreting ADH? Syndrome of inappropriate ADH secretion will occur. And you all know that ADH is a water loving hormone. So if a patient with a history of smoking and weight loss and cough and hemoptysis present to you with features of syndrome of inappropriate ADH secretion, then your diagnosis will be small cell lung cancer. So syndrome of inappropriate ADH secretion is a hint towards small cell lung cancer. So what are the features of syndrome of inappropriate ADH secretion? Can anyone tell me what are the features of SIADH, syndrome of inappropriate ADH secretion? ADH is a water loving hormone. So if it is secreted in large amount, what will happen?
Polyhydria.
Polyhydria?
No, sorry, polyuria. Excessive urine.
Are you sure about that? If ADH is secreted in large amount in the body, so the body will retain the water.
No, sir, opposite.
There'll be polydipsia.
Yes.
Polydipsia.
What kind of urine will be produced in SIDH? Diluted urine or concentrated urine?
It will be diluted.
Water is retained in the body and not excreted in the kidneys.
So it will be concentrated.
So yes, delusional hyponatremia. Someone with hyponatremia and concentrated urine or increased urine osmolarity, you will suspect SIADH. While the symptoms you people are telling that polyuria, polydipsia, and that is a feature of diabetes insipidus, in which there is decreased secretion of ADH and not increased secretion. So a patient with signs and symptoms such as cough, weight loss, and hemoptysis and hyponatremia, you will suspect small cell lung cancer. The other hormones that is secreted by the small cell lung cancer is ACTH. And ACTH production will lead to Cushing syndrome. So someone with either hyponatremia or with the features of Cushing syndrome, then you will suspect small cell lung cancer. Another disease that is associated with small cell lung cancer is Lambert-Eaton syndrome. What is Lambert-Eaton syndrome? Lambert-Eaton syndrome is a syndrome in which antibodies are produced against the voltage-gated calcium channels that are present in the presynaptic membranes. Because voltage-gated calcium channels are destroyed, so acetylcholine is not released by the presynaptic nerve terminals. So it results in a myasthenia-like syndrome, that is muscle weakness throughout the body. So three paraneoplastic syndromes are associated with small cell lung cancer. One is syndrome of inappropriate ADH secretion, other one is Cushing syndrome, and third one is Lambert-Eaton syndrome. What is the management of small cell lung cancer? surgery, chemotherapy, and radiotherapy can be done if the disease is localized and limited, and if the disease is metastasized or there's extensive metastasis, then palliative chemotherapy is offered. Non-small cell lung cancers are also managed by surgery and with chemotherapy or radiotherapy. The important point that you need to remember for non-small cell lung cancer, that is squamous cell carcinoma. Remember that squamous cell carcinoma is associated with two hormones can be secreted by squamous cell carcinoma. One of them is parathyroid hormone and the other one is thyroid hormone. Due to ectopic parathyroid hormone production and ectopic thyroid stimulating hormone production, squamous cell carcinoma is associated with hyperparathyroidism or hypercalcemia and hyperthyroidism, features of hyperthyroidism. So small cell lung cancer is associated with three paraneoplastic syndrome. One is SIADH, second is Cushing syndrome, and third one is Lambert-Eaton syndrome. And squamous cell carcinoma is associated with features of hyperparathyroidism or hyperthyroidism. Adenocarcinoma is associated with gynecomastia and hypertrophic pulmonary osteoarthropathy. Hypertrophic pulmonary osteoarthropathy, as its name indicates, it's an osteoarthropathy. Osteo means bones and arthro mean joints. So bone and joint pain is associated with adenocarcinoma. So these are some hints to diagnose a specific type of lung cancer. Now, what is Pancost tumor or Pancost syndrome? Pancost tumor is the tumor of the apex of the lungs. So if any of the tumor that is small cell lung cancer or non-small lung cancer, which is present at the apex of the lung, then it is known as Pancost tumor. Pancost tumor are mostly squamous cell carcinomas, but they can be sometimes adenocarcinoma, large cell carcinoma as well. What will happen if there is a tumor at the apex of the lung? It can compress the structures that are passing through or near the apex of the lung. The first structure that can be affected is a sympathetic chain. What will happen if there is compression of sympathetic plexus? Remember that whenever there is problem in sympathetic plexus in the cervical region, Horner syndrome will occur. What is Horner syndrome? Horner syndrome is pupillary constriction, ptosis, and anhidrosis. A triad of ptosis, meiosis, and anhidrosis is known as Horner syndrome because sympathetic plexus supplies the dilator pupillae muscle, levator palpebrae superioris muscle, and supplies the sweat glands that are present in the skin of the eyelid. So if it's damaged or compressed, dropping of the eyelid, constriction of the pupil, and anhidrosis, no sweating will result. That is known as Horner syndrome. So a person with a history of cough, smoking, and weight loss, and with features of Horner syndrome, you will suspect lung cancer. And specifically, you will say it is a Pancost tumor. Other signs and symptoms of Pancost syndrome, they can include when there is compression of the brachial plexus, what will happen? Wasting of the intrinsic muscles of the hands will occur, or paresthesia on the medial side of the arm will occur. So Horner syndrome, wasting of the intrinsic muscles of the hand and paresthesia in the medial side of the arm. Sometimes the recurrent laryngeal nerve can also be compressed by this Pancost tumor, and which will result in vocal cord paralysis or hoarseness of voice. And sometimes there's compression of the blood vessels such as subclavian artery and subclavian vein. So the compression of these blood vessels may result in edema, or the artery compression will result in the upper limb pain. So in short, Pancost tumor is a tumor of the apex of the lung that is mostly squamous cell carcinoma. It can cause a Pancost syndrome, which include Horner syndrome, wasting of the intrinsic muscles of the hand due to compression of the brachial plexus, hoarseness of voice due to compression of recurrent laryngeal nerve, and upper limb edema due to compression of the veins of the upper limb. So in an elderly who is smoker and present with chest pain, pleuritic chest pain, shortness of breath or cough, and signs of Horner syndrome, you will suspect or you will select lung cancer as the most likely diagnosis. Here's an X-ray of Pancost tumor. You can see this upper lobe haziness or upper lobe opacity. So this is a Pancost tumor that is present in the apex of the lung. So again, small cell cancer can lead to
So if there
SIADH.
is, sorry, if there is a subclavian vein or artery is compressed, what will be the symptoms? Will there be edema in the neck veins?
If subclavian is compressed, subclavian drain the upper limb.
Right.
So if there is compression of the subclavian vein, drainage of upper limb will not occur. So there will be edema of the upper limb. Nothing will happen to this neck veins.
Okay.
And due to compression of the subclavian artery, ischemic features of upper limb will be present, such as pallor, paresthesia, pain, etc.
Okay. Thank you.
So small cell lung cancer is associated with SIDH syndrome of inappropriate ADH secretion, which causes low serum sodium, low serum osmolality, and high urine osmolality. And squamous cell carcinoma of the lung is associated with hyperparathyroidism and hyperthyroidism. Don't confuse SIDH and diabetes insipidus. They are two different and opposite things. In one, there is excessive ADH secretion, and in one, there is deficient ADH secretion. Some other hint for squamous cell carcinoma, if in the questions they mention that there are large polygonal cells with keratin pulse and bridges. One hint for squamous cell carcinoma is it secretes parathyroid hormone, or it is associated with hypercalcemia. Second hint for squamous cell carcinoma is that on histopathology, there will be large polygonal cells with keratin pulse and bridges. As we discussed that asbestos can also lead to lung cancer. So we are done with the small cell and non-small cell lung cancer. Asbestos exposure can lead to cancer of the pleural membrane that is known as mesotheloma. So someone with a history of builder or shipyard worker and present to you with features of chronic cough, weight loss, hemoptysis, you will suspect mesotheloma. History of being a worker. For example, a builder or a shipyard worker. Remember that asbestos is used as an insulating material in different industries, such as building and shipyard development. So someone with a history of a blue collar worker, such as firefighter, construction worker, power plant worker, shipyard worker, or someone who is a veteran who has worked or served in the US Navy, but also in the US Army or Marine Corps. So someone with such kind of history, and he present to you with weight loss and shortness of breath and recurrent pleural effusion, you will suspect mesothelioma. Mesothelioma is an occupational lung disease that is associated with asbestos exposure. And if someone died due to mesothelioma, then you need to report and consult the case with coroner, because in occupational diseases, compensation is often available. That's why we need to report such kind of diseases to coroner first. So someone with features of lung cancer, such as shortness of breath and chest pain and weight loss and recurrent pleural effusion and a history of exposure to asbestos, such as a blue collar worker or an army personnel, then you will suspect mesothelioma. How we are going to make a diagnosis of mesothelioma? Initial investigation will be X-ray, and diagnosis is made on histology or biopsy that is done through a thoracoscopy. So remember that for lung cancer, the diagnosis was made on bronchoscopy, and for pleural cancer, the diagnosis is made on thoracoscopy. Thoracoscopy is done under local anesthesia. It enables the drainage of pleural fluid, as well as it helps us in taking a pleural biopsy, and also pleurodesis can also be done. Pleurodesis is obliteration of the pleural cavity. The diagnosis of mesothelioma is often made only post-mortem when the patient dies. The
So
prognosis of mesothelioma is very
sorry, in mesothelioma,
good.
the patient's lungs are not affected. It's just only the pleural cavity which is affected.
Yes, it is basically a cancer of pleural cavity.
Right.
Pleura is a membrane which contain mesoepithelial cells.
Cells, yes.
That's why it is known as mesothelioma.
Okay.
So if on X-ray you see pleural plaques or pleural thickening, or on CT scan pleural thickening or pleural plaques, then you will suspect, in a patient with a history of asbestos exposure, you will suspect mesothelioma. And you'll confirm your diagnosis by doing a thoracoscopy, by taking a biopsy specimen.
That's fine. Thank you.
The prognosis of mesothelioma is very poor. Median survival from diagnosis is about 8 to 14 months. Surgery has a limited role. Sometimes palliative chemotherapy can be offered, and radiotherapy as well. So in elderly male with history of shortness of breath, cough, sputum or weight loss, we'll suspect lung cancer. Initial investigation will be X-ray, and definitive will be bronchoscopy. CT scan can be used for staging of the disease. Someone with a history of asbestos exposure will suspect mesothelioma. Initial investigation will be X-ray or CT scan, and the diagnosis will be made on thoracoscopy. Someone with features of Horner syndrome or brachial plexus compression or upper limb blood vessels compression, we'll suspect a Pancost tumor. So this was all about lung cancer and its different types, their diagnosis and management.